My name is Clarissa Gosney. I am a licensed psychologist, and I received my doctorate of clinical psychology at the California School of Professional Psychology. I have been practicing counseling since 2011, so it's been 8 years. So when we talk about gender fluidity or gender identification, I almost feel like there's, even though there's talk about let's make gender more fluid, more of a fluid concept, there's almost a hyper focus on boy and girl norms, so these gender norms. And if these children don't fit strictly into the boy gender norm or the girl gender norm, the thought is to teach them that they might be something else. They might be somewhere in the middle. They might be both. They might not be either one. They may be able to switch back and forth. And so being able to propose that to a child and say, well, you know what, you're a little girl who likes to run and you like to play in the dirt. Do you know that you might not be a girl? You might be a boy, and you get to choose that. What a confusing concept that is at such a young age for a child who really, in their mind, they're just being a kid. They're needing to be creative. They're needing to have that flexibility in their play and in their environment. And we're coming in and saying, well, let's put a label on what you're doing. So we're taking this concept of boy labels and girl labels are bad, but if you waver from those at all, you're putting a different label on them and having them choose exactly what they are, what they want to be. And that can be very confusing regarding whether children are capable of comprehending the idea of transgenderism, choosing your own gender, gender fluidity in kindergarten, I think is a bit too young. We're talking about higher level concepts here. I mean, a lot of these children are for the first time finding out that there's differences between the sex that you're born with, the males and females. Had someone come to me as a young child and said, you don't wear the pink frilly dresses, you don't play with Barbie dolls, you've got a creepy crawler machine instead of an easy bake oven, you could be a boy. And that is your choice. I would have been terribly confused. I think it can be very confusing to introduce sexual concepts to a child whose brain is not in a sexual stage of development. Kindergartners, elementary schoolers, they're not thinking about sex. Any adult who's listening, think back to when you were in elementary school. Think back to kindergarten. Think back to first grade. You weren't thinking about whether you wanted to kiss a girl or a boy or even kissing anybody at all. If it was complete innocence. We're thinking about what we're going to play next and what we're going to have for lunch. Did mom pack me a Twinkie, or am I going to get a carrot again? These things aren't on the brains of these young children. So to introduce these concepts before their brains are ready to handle them and before that natural course of development comes, it can lead to a whole lot of confusion. So according to Erickson, ages 12 to 18 is when we really try to figure out who we are. That is the critical age of trying to figure out who we are. Erickson states that if we don't figure out who we are in that time, we could have a major lack of confidence in ourselves, and you can see it even into adulthood, people trying all these different things to try to figure out who they are. So when we look at Erickson's 5th stage of development in the identity versus role confusion, I know nowadays we hear the word identity and it's kind of a name that automatically brings us back to sexuality, sexual identity. What Erickson was looking at is the identity of a person as a whole. Not choosing their gender, not choosing their sexual orientation, but figuring out what they really like to do. What are the types of friends that they want to hang out with? What do they believe in? What are some of these core concepts that they can piece together to be able to really identify and feel comfortable within themselves so that they can move on to the next stage of development successfully and be able to be confident going out into our society, into our culture, into the business world, into college, and really knowing who they are, what they believe in, what they stand for. So when we talk about introducing the concepts of choice in who we are, about transgenderism, about homosexuality, bisexuality, all of these different concepts, and teaching these children that they really get to choose what they're going to be, the place where I always go back to is brain development. So our brains don't stop developing. They're not completed with their development until age 25. And studies have shown, research has shown that teenagers use a much different part of their brain than adults do. So adults tend to think with their prefrontal cortex, and that's where we make rational decisions. We use logic, we use planning. If there's something going wrong with the prefrontal cortex, you see a lot of impulsivity, a lot of rash decision making. When we look at teenagers and the way that their brains are wired and how they're firing when they're making decisions, is that they tend to operate out of the amygdala, which is the emotional part of the brain. So when we're looking at the appropriate age to really be talking about identity and locking in who we are, the decisions that we're making, granted, we're always changing, we're always evolving. Every new experience that we have changes what happens in the next step. But when we're looking at that brain development and not making impulsive decisions, letting ourselves kind of wait it out and see when we start making more rational, logical choices, that's after age 25. So when we look at people who say, you know, my 4-year-old born a male is really a girl, and we want to look into hormone treatment, that child's not capable of making that decision at that age. If we're smart about it, we're going to wait until the impulsive part of their brain stops operating first and foremost. We're going to wait till that age 25 when they start thinking logically with their prefrontal cortex to be able to make those decisions.